Hi, Medicare Mary here, and welcome back to the BGA Agent Academy. Today, I'm going to teach you all about Medicare Part D. I believe this is probably the most important part of assisting your clients with their coverage, because choosing a plan that does not suit their needs can cost them thousands of dollars unnecessarily. For today's lesson, we are going to take an in-depth look at what Medicare Part D is, how it works, how to get it, and how to figure out the best options for your clients. So let's have a look. Let's start by first defining what Medicare Part D is. Medicare Part D provides coverage for prescription drugs. We call these plans prescription drug plans, or PDPs for short. Part D plans are provided by private insurance companies and sold by agents. Medicare beneficiaries can obtain Part D coverage in one of two ways. If they are on original Medicare, with or without a Medicare supplement, they would get their Part D coverage via an individual PDP. If they choose a Medicare Advantage plan, then they would have to obtain Part D through that plan, and those plans are referred to as MAPD. For a client to enroll in Part D, they must meet the following requirements. They must have Part A and/or Part B. They also must live in the plan service area. Last but not least, the client must qualify for an enrollment period. Part D plan service areas are usually by state, and clients may have upwards of 30 plans to choose from. So what makes each plan different, and why might a client want one plan over another? Let's find out. Let's start our Part D discussion by addressing the costs of the coverage and the four coverage stages. The first expense for your clients is the fixed monthly premium. Premiums can range substantially. They have been as low as $0 per month and can be well over $100. The premiums are set by the private insurers, and typically the higher premium may result in lower out-of-pocket when using the plan, but not always. Remember, as mentioned in a previous video, Part D is also subject to IRMA when a client's modified adjusted income is above a certain level 2 years prior. IRMA is charged in addition to the monthly premium for the plan. Clients will also have drug costs based on the dosage, quantity, and frequency of the prescription drugs they're taking, as well as what tier the drug falls on, and if they use a preferred in-network pharmacy. Their costs will come in the form of co-pays or co-insurance and a deductible if the plan has one. Eventually, if their prescription drug cost goes too high, they will hit the coverage gap, also known as the donut hole, where costs go even higher. Thankfully, the donut hole is being eliminated in 2025, so we can remove that from our discussion. Finally, catastrophic coverage happens after your client has reached their maximum out-of-pocket and they get a break and have no further copays for that year. There is one other possible charge your clients may have to deal with, and that is the late enrollment penalty, or LEP. If your client did not sign up for Part D coverage when they first became eligible, they may be subject to a premium add-on that is calculated as 1% of the national base premium multiplied by the number of months without coverage. In 2024, the base premium was $34.70, so the penalty is 1% of that amount for each month without coverage. This is added to their monthly premium. Now, it's time to take a deeper look into the different stages of Part D coverage. Remember, since the coverage gap is being eliminated for 2025, we will not discuss it any further and focus only on the rules as they will now apply. The first stage of Part D drug plans is the deductible. During this stage, the member will pay 100% of their drug cost. Not all plans will have a deductible, and some may have one that is lower than the allowable amount set by CMS. For 2025, the maximum deductible will be $590. The second stage of Part D drug plans is initial coverage. When a member satisfies the plan deductible and enters initial coverage, they are then responsible for 25% of the cost of their drugs. This is usually done as a copay rather than a percentage, and the copay will depend on the tier the drug falls on. Most plans will have drug tiers set up for things like generic or name brand drugs. Many plans operate on a 5-tier system that goes something like this. Tier 1 is a preferred generic, Tier 2 is a non-preferred generic, Tier 3 is a preferred brand, Tier 4 is a non-preferred brand, and Tier 5 is reserved for specialty drugs. The higher the tier, the more your client will pay. This is why it is so important to review your clients' prescriptions with them and help find a plan that covers their drugs at the lowest tiers possible. The final coverage phase, starting in 2025, is catastrophic coverage. When a member reaches their out-of-pocket spending cap, which is $2,000 for 2025, they will enter this phase and no longer have a payment for their prescriptions. At this point, the cost of the drugs will be divided between the plan, the drug manufacturer, and Medicare, leaving your client with no further out-of-pocket costs. This is a significant change over previous years, and for your clients taking expensive prescriptions, this could be a huge savings. Just when you thought we were done, there is a whole lot more to go. Over the next few slides, we are going to discuss these items that also will impact your client's Part D coverage. As an agent, you need to be aware of these different items and help make sure your clients are taking advantage of what is available to them. Let's start with Low-Income Subsidy, also known as LIS. Low-Income Subsidy or Extra Help Program is a federal program that helps people with limited income and assets pay for prescription medications and other related costs. People who qualify for extra help will pay no deductibles, no premiums for Part D drug plans, a low set copayment for brand and a lower one for generics. This changes each year, and no Part D late enrollment penalty if applicable. To qualify, a member and their spouse must earn lower than the yearly income limit that is changed annually based on a percentage of the federal poverty level. Lastly, a member will get Part D extra help automatically if they are enrolled in both Medicare and Medicaid, dual eligible, receive Supplemental Security Income, SSI, or qualify for a Medicare savings program. Many states also have pharmaceutical assistance plans, and you would want to assist your clients in looking up what is available for them in their resident state. As of January 1, 2023, Medicare Part D plans and Medicare Advantage plans no longer require a deductible, coinsurance, or other cost-sharing requirements for adult vaccines that are recommended by the CDC. This includes the shingles vaccine. Also, as of January 1, 2023, cost sharing for insulin products is limited to no more than $35 per month. This includes insulin covered under both Part D and Part B. No deductibles apply. Remember, plans are not required to cover all brands and types of insulin. Just another reason you need to work with your clients on finding the right plan. Beginning January 1, 2025, each Medicare prescription drug plan, including MAPD, must give members the option to pay for their out-of-pocket prescription costs in monthly installments, with a monthly limit on spending. This will more evenly distribute costs throughout the year. Remember, members will need to enroll in smoothing. This will not be automatic. I know what you may be thinking, what now? For agents just getting started, the idea of figuring out how to find the right plan for your client may seem like a daunting task, but I promise you it's not. At BGA, we provide tools for our agents to not only collect the data needed from their clients to find the right plan, but also the software necessary to price these plans accordingly when it comes to what prescriptions the customer takes, as well as alternatives within certain plans. BGA has partnered with Retire Flow, so for agents who contract with us, you will have your own account at no cost. Using Retire Flow will allow you to send a link to your clients via email or text that will assist them in providing their prescription information, the pharmacy they prefer, and even the doctors they see, as well as a fully compliant scope of appointment. Agents who contract with BGA also gain access to the Sunfire platform, which will allow them to use the collected information and then quote and enroll a client into a plan. These are just a few of the ways BGA Insurance Group is here to help agents. You can find out more about working with us by checking us out at www.bgafmo.com or call 844-625-4415. Remember, BGA Insurance Group is an FMO of agents, by agents, and for agents. Until next time, this is Medicare Mary saying happy selling.